Okay, good evening again. We will directly move to the part two of the topic tuberculosis, which is the clinical features. This is going to be very short, ultra short presentation because most of the people, most of the medical students in India will know what are the clinical features of tuberculosis. So I'm not going to keep beating around the bush. The intention of this presentation is to just give you an access to recall and reproduce the answers when it comes to clinical features of tuberculosis. So I'm starting to share the screen now. So tuberculosis clinical features. Let's just get familiar with few slides. As I said, the intention is only that to support you in having things added, clinical features added to your memory. So first thing is the fatigue, which could be a only symptom of a patient with tuberculosis, especially in the early period. Weight loss before and after tuberculosis, which will be significant weight loss and unintentional one. This is not the weight loss that was gained due to exercise and dieting. Cough, or patients can also have cough with blood, that is hemoptysis. Fever, which is usually of low grade, but it is not unusual to find high grade fever even in tuberculosis with drenching sweats in the night. And on examination and specifically on auscultation, you can find evidences for cavity, collapse, consolidation in a patient with tuberculosis, in addition to other features, like a patch of consolidation or a thin strip of fluid leafing to massive pneumothorax, massive pleural effusion. All these features are possible. It's an umbrella of manifestations that tuberculosis can manifest with. So you can pick some findings which is classical of tuberculosis, like cavity, consolidation, or collapse. So this is a slide which helps you retain features relevant to when it comes to answer. So T for tiredness or fatigue, U for unintentional weight loss, B for blood in sputum, hemoptysis, or breathlessness. For breathlessness to happen, it usually takes some time. Extrapulmonary manifestations with extrapulmonary disease for E, this is a patient with tuberculosis can have a meningitis, life-threatening meningitis, or a patient with same CNS tuberculosis can also be in the form of just a stroke, where it causes vasculitis and that causes a stroke. So there is varied amount of there is mostly no organ in your body that is untouched by tuberculosis if it chooses to, and when your body is weak. So it will be difficult to contain every aspect of manifestation in extrapulmonary tuberculosis. So you can broadly consider that tuberculosis can directly cause the effect due to the chronic inflammation disease that it is associated with, or it could be a mechanical effect. The mass of tuberculomas and tubercles found by the tuberculosis in critical areas, they may impinge on the adjacent structures and start causing damage because of mechanical destruction. So based on this, you can start stretching the answers when it comes to extrapulmonary manifestations and extrapulmonary disease. R for raised temperature, usually as mentioned, low grade fever and chills are not uncommon. C for cough and co-infections. Sometimes the tuberculosis may not be apparent because of other co-infections, especially HIV virus infection. So this weight loss, if a patient with HIV is, we have to have a high index of suspicion to have a coexisting tuberculosis also. Next is U for umbrella manifestations within lung. So there could be a cavity, calcified granulomas, collapse, or consolidation in the patient with tuberculosis. And L for lymphadenopathy, and also loss of appetite. So this unintentional weight loss and the loss of appetite, it's not a dieting. There is actual loss of appetite. A friend of mine wanted to have failure to thrive in a children with tuberculosis. So I'm having the letter there, which is when there will be refusal of feeds and malnourishment. O for occult dissemination. Well, that can result in chest pain due to pericardial effusion, massive pericardial effusion which got slowly built, because no primary lung pathology was identified or presented early stages. So lately, when there is occult dissemination without someone's knowledge, they may insidiously producing a pericardial effusion, which can result in cardiac tamponade in later stages. And abscesses. So the heterogeneous dissemination of tuberculosis bacilli can happen in multiple areas and forming pockets of abscesses called pockets of pus, resulting in abscesses. Next, S for sweating in nights. They profusely sweat, resulting in the whole body drenching in sweats. And though the symptoms which we discussed are presenting, they sometimes can seemingly harmlessly present with simple infertility, especially in females. When the genital tract is infected with tuberculosis with multiple adhesions, it may be the one factor for infertility. And the last one is even more seemingly unharmful. Could be a sterile pyorrhea, where patient has no symptoms, but the urine examination will show pyorrhea with no organisms that can be grown on cultures. Okay, so these are the manifestations with which the tuberculosis can present, especially the clinical features. So just a short slide. I wish this will help you retain much for your memory when you want to answer and recall. That's it from this slide. Thank you for joining me in this short presentation. I'm going to stop sharing the screen now. Well, thank you for being with me and going through this video. Wish to be in touch with you soon. Okay, take care. Bye.